Sometimes children just don't seem to be meeting the milestones that are set by the NHS and the education system. And before the age of 5, we can sometimes see that our children look a little bit different, or they're presenting a little bit differently to their peers. There's nothing to worry about. However, there's lots to learn. So as a parent, you may be pointed towards looking at autism to see whether you think perhaps your child is autistic, or perhaps you're pointed towards ADHD and you're told you may need to consider your child has ADHD. Now, what I would say to you, if this is a conversation you've had with your nursery setting, upskill yourself. There is nothing to be lost from learning more about autism and ADHD in early years, because the information you gain now will absolutely help when you get to an assessment, because the assessor, the clinician, will be questioning you as well about your child's presentation and any observations you may have. And if you know the correct language and you know what you're looking for, then you're able to give them more accurate information that they also understand. It might not be this, or it might be this. And by this, I mean neurodivergence. I have ADHD and I think it's wonderful for me. And there are absolute downsides, but there are major upsides as well. And one of the things that I'm really keen to empower parents about is getting that assistance that you need and getting a diagnosis early. Because a diagnosis is not a label, it's an identity. And the sooner we receive our identity and understand it, the better our long-term outcomes will be. So we have a fantastic webinar coming up. We're going to be talking all about autism and ADHD in early years. It's fabulous for parents, fabulous for educators, and if you work in a nursery setting, brilliant. Please do come along. We're going to be talking about what autism looks like in early years, and what ADHD looks like in early years, and what you can do to get funded support and get specific support that's actually structured and strategized for the child. So come and join us. I've put all the details below.